I am Amy Elgin. I am an occupational therapist with Tri-County Therapy. I've been an occupational therapist for 20 years. An occupational therapist is someone who works with people of all ages who need specialized intervention to enhance their quality of life due to physical, social, developmental, psychological, emotional, and sensory deficits. An occupational therapist is a very unique service. We are trained individuals to look at the whole child. So we don't look at just isolated incidents or episodes of deficit with children. We look at them as a whole child, their entire development, their emotional status, their sensory regulation, their ability to participate in their daily life activities or their occupations, which is where the occupational portion of that comes from. We are problem solvers. So I think we have to look at children in very creative ways. Our goal is to give them everyday tasks in which they want to participate and use those in unique and innovative ways to get them engaged in therapy. Our goal is to get the child back to doing the things they love to do. Another unique aspect, I believe, of occupational therapy that's often overlooked is we work with the whole family. The child is part of a dynamic relationship with the family, and often if a child is experiencing difficulties, it's also impacting upon family. Mothers want to be able to take their children out to the grocery store with them, and it might be too overwhelming with all of the sounds and the sights. They want to be able to take their child to a dinner at a restaurant with the family and engage in that activity. They want to be able to take them to church. So if a child is experiencing deficits in any of these areas, it has impacts on the family dynamic as well. So an occupational therapist, referrals to us come for many different deficits. Some children come with a diagnosis and others just a delay in a certain area, such as fine motor, visual motor, sensory motor, daily living skills. Some of the ones that I think most people recognize, kids come to us a lot for handwriting difficulties, which is fine motor. They come to us because they have difficulty with transitions and might have meltdowns going from one point to another. They might have difficulties feeding themselves, getting dressed, sitting still. So we look at the whole child and try to not only just determine what the isolated skills are that they're having difficulty with, but what are the underlying components that is causing that dysfunction. So as an occupational therapist, we work with a lot of different labels and diagnoses, autism, cerebral palsy, spina bifida. A lot of times kids come to us just with a feeding disorder diagnosis and also just global developmental delay as well. As a PA, there are a lot of reasons to refer to occupational therapy. I think some of them are a lot more obvious. The fine motor skills tend to jump out a little bit more, I believe, at well checks and visits like that. Children that have difficulty with handwriting, using tools of everyday life, being able to use scissors, manipulate clothing fasteners, feed themselves using a spoon and a fork. Those are all issues that I think come out a little bit more prevalently in well checks. Some of the other things that occupational therapists work on, picky eating is one. A lot of children go through a phase of picky eating, but it's those children that might gag when they smell or are just in the presence of different textures and foods. These are kids that drop foods out of their repertoire and they don't add them back in at a later time. So their food preferences continue to narrow until they're eating just a very few amounts of food and not getting the nutritional intake that they need. Some other areas that occupational therapists address would be emotional regulation, kids that really cannot cope, task coping in different environments. So they might have difficulty in areas with loud noises, bright lights. They might not be doing well in school because they cannot transition from one point to another and have meltdowns. Some of the other areas that occupational therapy treats would be daily living skills that are not age appropriate. Kids that cannot brush their teeth or get dressed or undressed, manage hygiene at an age appropriate level are all areas that an OT can treat. I would recommend, when speaking with a parent, if there's any concerns or doubts, to refer to an occupational therapist. As I was saying before, the skill level that they're at, it could be attributed to many different things. A lot of times it's not really the skill itself that is the issue. The child might have poor handwriting because they have sensory regulation difficulties and can't sit still long enough to get the instruction that they need. It might be a visual motor difficulty where they can't look at the letters and figure out how to correctly duplicate them. So it could be bilateral hand skills where they just cannot use their hands together to fasten a button. So an occupational therapist is trained to really delve into whatever strategies we need to figure out the underlying cause of the deficits that we're seeing. So as an occupational therapist, I feel that it is very important to have parent involvement from the beginning. We typically have the parent sit in on the evaluation process so that they can see exactly what we do, they can answer questions and let us know their main goals, priorities, concerns, so that we're addressing the most important things to the family. And that follows through into intervention. We want to make sure the parents are part of the process so that we are addressing the areas most important to them to regain the function in the life that they envision for them and their child. So occupational therapy, again, really looks at the whole child and includes the family. Our goal would be to have the family understand exactly what we're doing in our interventions so that they can follow through with that. We only have their child for a very short amount of time, each week. So if we can get the parent to understand what we're doing and the purpose of it and the importance of it, and then have them follow through with that all of the remaining time that they have with the child that week, it's much more successful for the child and the family overall. As a PA, I would recommend referring a child to occupational therapy at any point if you feel that there are delays, deficits, anything impacting upon the quality of life of the child and the family. So, being able to encourage them to at least go for the evaluation to determine a baseline of where their child is, kind of empowering them to have the information that they need to help their child be successful.